UK, and he was suffering from osteoarthritis. And they have performed high replacement hip surgery with high performance hip replacement surgery with the help of advanced technology. And this was performed by a remarkable orthopedic surgeon, Dr. Vijay C. Bose, and his expert And today, ladies and gentlemen, we have gathered here to publicize this success. There is patient Mr. Michael McKenna, who has traveled all the way from UK and has opted and trusted SIMS and our doctors for this advanced treatment. Thank you, sir. And next, I would like to welcome our esteemed Vice President, Dr. Raju Sivaswamy, sir, who with his futuristic vision and dynamic administrative skill has brought forth a pillar and during the path of success to the SIMS. Thank you, sir. It's an honor to have you here. And I would like you to see.
And SIMS Hospital and the whole SIMS family members, we welcome you all for this gathering for new performance of high performance hip replacement surgery using advanced technology by our Joint Director Dr. Vijay C. Bose and his whole team, who has done extremely. He is not only for the hip, he is the best pioneer in hip replacement for total hip resurfacing, partial hip replacement and total hip replacement. Now one more further, with this advanced technology, they are able to perform in a better way. These are all to give the best outcome to the patient. And our hospital has got 15 operation theatres, and we have dedicated hip replacement theatre, spine surgery theatre, orthoscopic, like that we have advanced theatre with laminar flow. And last year we have got the robotic knee system, first time in Tamil Nadu, and now the other technology has been instituted by our Joint Director, and he will explain in detail about the technology, what he have adapted and how they have done the surgery. Thank you for being here, sir. Thank you.
They got us all the technology and all that we need yesterday. So thank you, Dr. Raju. Dr. Suryanarayan is here. He's actually our head of the Department of Orthopedics. And warm welcome to all the media people. Michael McKenna, who is the patient that who has come all the way from UK. So thanks very much for coming, Michael. So this is actually, so I'll try to explain what we do here. And this is some technology that we developed in-house. We have developed in Chennai, we have developed in SIMS Hospital, we have developed in our Orthopedic Institute. And something we are very proud of. And hopefully, it will spread to the rest of the world. So this is his X-ray. You can see that's his left hip. The right hip is normal. You can see how the left hip is damaged. And he is from the UK. Now, what you should know is that the hip replacement surgery is free in the national service. I worked in the UK national service for 6 years, and all surgeries are free, completely free of charge. But leaving what is free to him in the UK, he chose all the way to come across the world to Chennai to have his surgery done. So the question to ask today is, why did he choose to come so far for hip surgery? So he's actually a builder by occupation. And I believe what the surgeons there in the UK told him is, you can have hip replacement, pain will go away, but he had to give up his job as a builder. And that was the problem. So he chose to continue his job and then as a builder. And as you know, building, activities involve climbing ladders, climbing on roofs, etc. So he chose to come here. That's taken at the time of the surgery. So this is what we have developed, how we use technology to get high performance after the surgery. So generally it's thought that once you have an artificial hip done, surgery, the pain will go away, but your activities are limited. Generally you walk with a cane, and then you're not able to do very activities. You can just sit and stand. You can't do anything much else. That's what usually what is thought. Now in recent years, technology has revolutionized everything. I'm sure you all agree with that. Everything is revolutionary because of the modern technology that we have. And if we take rental mobility, rental things, we always, whenever we think of something very fancy like Google self-driving taxis or autonomous, but this is not where the real revolution occurs. This is the top end. The real revolution occurs in what we call the bottom of the pyramid. So our Ola and Uber, that is really the technology driven. Before Ola and Uber, we couldn't take a taxi, but now we all take taxis. Now we have two-wheeler taxis also, autos. That's where the real revolution occurs. That's occur at the bottom of the pyramid, as we call it. So if we take technology as a THRs, everybody will talk about robots. So we also have a robot for knee replacement today in our hospital, but we don't have one for hip replacement because it is still not a mature technology. Like if you take electric cars, for example, we had electric cars for a long time, but now only the technology is mature. So the robotic for hip replacement is still not mature, and therefore we don't have one at the moment. More than that, it's expensive, it's about 8 crores. So we thought we should do something about it, and do something that will be accessible for everybody and every patient and every hospital. So what does the robot do? It does some technical things. It gives you these 5 things. That's what basically what the robot does. So we decided to do something about it. SIMS Hospital in our Ortho Institute, Asian Orthopedic Institute, and we developed this one. So we are very proud to call it zero cost alternative for hip robotics. So this costs 8 crores. That has no cost involved actually. So because we all have our smartphones, each one of us has a smartphone. So we are using the smartphone as the basis, but there are a lot of other things involved. So we call it die-cast. That stands for digital inclinometer and coaxial stitch technique, which over the years Surya and myself developed in this hospital. So this is for everyone, whereas robotics, even in the Western countries, even in affluent countries, is only for a very small proportion of people. Everybody is not going to have Google flying taxis, but Uber and Ola is what's going to be the revolution like that. So finally, the patient should benefit. That's the goal. So this is what we have developed: zero cost substitute for hip robotics. So these are the things that. So it's not just a question of using an app for a mobile phone. It's much more than that. These are all concepts that we have developed in hip surgery. So this is what we do during surgery, and this is a modified app that we use in a cell phone. You can see how an ordinary smartphone is put into the sterile plastic cover and becomes sterile, and then you can use it as a technology during surgery. And therefore, there is no cost involved. The only cost is that plastic bag cost. That's the only cost that's involved in this thing. This app we are planning to give free to everyone. So it's not just the app, it is the 3D balancing which has got many concepts. So anything like this, you need to scientifically prove it. You have to publish it in peer-reviewed journals before it's, that you can show it to public or show it to others. So we have published it in peer-reviewed journal and everything has been scientifically validated. That's very, very important. It's not just fancy doing something on the smartphone. It doesn't work like that. So there are various concepts involved. I won't go into the technical part of it, but basically, we want to align the patient as if he's sitting. We want to make him lie down. So what we do is we do all the markings while he's sitting, and then when he's lying down, we use the smartphone to make sure that we have transferred what he's sitting as standing. That's fundamental number 1. And again, we use the smartphone for that. And here you can see the video. This is the cup that has been put in, and you can see that how the smartphone is being used, and you can see the value coming. What is your actual angle? Now human error is there. So what we really want to do is to eliminate human error there. So you can see that exactly what angle that we want. And once you find it's perfectly aligned, the performance, you can allow the patient to do whatever they want. And that is the idea of how we have modified this to exactly eliminate human error in that thing. Now, it's not always, keep in mind always, the machines are not superior to human skill. In some things, even today, the human skill is better than machines, than software, etc. So if you look at perpendicular and parallel, if this wall, if you say is it really parallel, the human eye can be as accurate as 1 degree. So human eye is better than machines in some things. Human eye is very bad in measuring angles. So we have used all these concepts, and we, so some of this is where the human eye is very good. We use the human eye, and then we find that we are very, 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 very accurate when we are doing that. So this is again how we do it. Different parameters being done so accurately. So we are done on that. This is during surgery. This is how we do the surgery. This is our operating room in SIMS, and then we measure the value. So what you want based on the X-ray, what you want, we achieve that, and that's the whole technology. And we are doing it at no cost, and that's the beauty of the whole technology. And we are so proud that we have done it in Chennai, in India, in SIMS, in our Orthopedic Institute. And it's already getting popular world over. So people would find that instead of spending 12 crores or 10 crores on robot, they could do this, and it gives exactly the same things. And you can see how the plastic bag is there, just an ordinary smartphone with that app, and then we are able to we're able to see that exactly what value that you want. The first one was the different thing that we used. Here it is the femur or thigh bone. The first video I showed you was the pelvis or the socket bone. So we're able to exactly get what we want. So these are all technical things, I won't go into it, but so it's not just the app, but there is technology and the concept that we developed and published along with the app that's important. This again, very important thing, but it's not technical, so I won't go to it. Now, apart from this one, some patients may have spine problems. When they have spine problems, it reflects on the pelvis, and to put the socket is very difficult, the artificial socket. So again, we use the die-cast technology that we developed, and then we're able to get exactly where we want things to be. This again comes at no cost, and that's the beauty of the whole thing. And here's a patient, you can see completely deformed pelvis. The left hip is fused and been there for a long time since their childhood. And this is very, again, it's very impossible to do with the pelvis is in all, turned this way, twisted that way. We cannot do by the human capabilities. So we use the die cast, and then we are able to do everything very accurately. This is a patient who came from Punjab. He had a hip replacement done, dislocated, you can see that. So again, we are using die cast, and then we are able to put the cup the right place, and then everything is fine. So this is what the robot does, all these technical parameters. And without the robot, with the use of die cast, we are able to achieve everything, giving a value number. You saw how the number was given during surgery. Each value has got a number, and we are able to do it without any cost. And that's the beauty of the whole thing. We are so proud that we have developed it here in Chennai. This is one of my patients who, he had a hip replacement, and 8 months after he climbed Mount Kilimanjaro. So it's all lots and lots of patients who come to us for high performance hips from all over the world, and they are able to do all sorts of things. And some of my patients, sitting on the floor is very important in Asia, may not be that important in the UK. Sitting cross-legged, squatting. Another patient from Canada who was horse riding and bicycling a few weeks after surgery. So these are all we are able to achieve because of how we are able to position the components and give them high performance. So what should we aspire for? 2002, this is for everyone. So you are only limited by your own imagination. So your aspiration is limited only by, so you can imagine something big, you can achieve it. It's just a question of how we go about it. So you must have heard of Elon Musk. His aspiration is to have 1 million people, humans, on Mars by 2050. That's really a high aspiration. So the aspiration is limited only by your imagination. So this is another patient from Costa Rica. This is post-op, this is after surgery. And you look so from what hip replacement was earlier, before we had this technology where people had to be very careful only walking and sitting, we are able to give a really fantastic function post-op. Using this technology, which the beauty of it is that it is comes at no cost. We are so proud that we developed in India. So I believe that one can aspire to as much as one wants to. There's no limitation. It's limited only by your imagination. So thank you for that. That was the thing. So the Orthopedic Institute has so many things. So we specialize foot and ankle, spine deformity, trauma, and the work that we did is from the joint replacement unit. So thanks again.
The main one being that the hip replacement I would have got in the UK would have seriously impacted my life. I wouldn't have been able to work, excuse me, and there are vast limitations on a normal hip. It can dislocate just by crossing your legs. So far today, I've been up about, I'm very mobile, and thanks to Dr. Bose, I'll be back to work hopefully very soon. So everything I've had here has been second to none. I think a little tweak maybe for your continental food, but hey ho, that's a minor issue, isn't it? So thank you all, and Dr. Bose, very much.
Most welcome.